So myopia is short-sightedness. That means that when you look at things in the distance, they look blurred, but when you look at something close up, you can see very fine detail. It typically starts in childhood years. It used to start at the age of about 10, but now we see that it starts much earlier. So I often see children who are only 5 or 6 years old who are beginning to have myopia. What it means to the quality of life of the child is, well, they cannot see things in the distance very clearly without glasses. And as they get older, usually the prescription increases, so they become more and more dependent on the glasses. It particularly interferes with sporting activities where they have to see things at a far distance, or even in the swimming pool where they sometimes can't see the coach or the clock at the end of the pool. It also causes some anxiety to the children because the prescription gets thicker every year and they don't really understand why that is happening. So overall, the impact on the child's quality of life is both for education, seeing things in the distance on the whiteboard, but also for sporting activities and in terms of being a bit anxious about the changes in their prescription. The standard treatment for myopia at the moment is just standard glasses. They are called single vision lenses. They correct your short-sightedness with distance vision, and children can then see things clearly in the distance and at a close range without difficulties whilst wearing the glasses. Some children also like to change to contact lenses, particularly for outdoor sports activities. So these two types of treatments, glasses and contact lenses, are still the standard. However, over the past few years, new treatments have been introduced, which also slow down the progression of myopia. So instead of having, let's say, a 1 diopter increase every year, they can slow down the progression by about 50%. And the 3 types of treatments that can slow down myopia progression are special contact lenses, special glasses, and low concentration atropine eye drops. There is a very important difference between myopia in children and myopia in adults. In adults, the eyeball has fully grown and doesn't change anymore. So at that stage, it is just managed by glasses or contact lenses or laser eye surgery. In children, the situation is fundamentally different because whilst children are still growing up and growing taller, the eyeballs are also growing slightly longer year on year. So the myopia increases. That is why children need to have an eye test every 12 months at least to keep up with the prescription for glasses, to keep it up to date, to enable them to have the best possible vision. This is also the reason why the myopia slowing treatments only work in children. These treatments aim to reduce the growth of the eyeball over time and thereby slow the progression of myopia. So the myopia management in children that aims to slow progression needs to continue until the myopia has stabilized. So ideally, the child needs to be reviewed every 6 months to check progression. In my clinic, we use a very sensitive measurement, a measurement of the length of the eyeball, which measures the increase in length every 6 months. And once that measurement becomes stable, which is typically in the late teenage years, then we can start to wean off the treatment and reduce it progressively, still monitoring the axial length change every 6 months until we are satisfied that it remains stable. Parents often ask me what they can do at home in addition to the special glasses, contact lenses, and atropine eye drops. And the general advice is, particularly for younger children who do not yet have myopia, to take them outdoors as much as possible, at least an hour and a half a day if you can, because being exposed to sunlight outside will slow down the onset of myopia. It also has a small effect on slowing down progression, but the effect is not as big as that of contact lenses, glasses, and atropine eye drops. In addition, being outdoors and engaging in some sports or teams activities even contributes to the social development of the child. And the other important aspect is the near focus work. These days, children, particularly with our urban lifestyle, spend a lot of time on books, screens, mobile phones, etc. And we believe that this constant near focus also drives myopia onset and progression. So if children have to use these devices, particularly for learning, encourage them to keep a working distance of about 30 centimeters. If they use a book, again, keep the working distance and make sure that they have good lighting from behind falling onto the page of the book. Try to limit the use of screens if possible, but meaningful interactions online are very important for their social development as well. So it will not be possible to completely ban screens from the household. So just try to make sure that they are used in a sensible way.